So I'm extremely excited about the opportunity to be here, 51 participants. I'm not sure if you all can hear me or see me because I can't see myself and I can't hear myself either.
We can see and hear you, Mr. Oliver, if that helps. We can't see you, but I can hear you.
Okay, so you can see me. And then you get this pre-COVID picture of me as clean lineup. I appreciate it. So I am thankful for the opportunity to be here and thankful for the opportunity to serve community. As many of you know, I'm president and CEO at the Community Foundation of Greater Flint, which means I lead an organization focused on engaging people in the world of philanthropy. Philanthropy not just singularly focused on treasure, but how we give our time and our talent. And as a result of the work that we do and the way that we engage in this work to make the community a better place to live in, work in, and contribute to, I've had the opportunity to work on initiatives that fill the gaps for people in our community. And I will work around coronavirus or urgent relief response has been no different than our commitment to this community over the last 32 years. We are excited today because as a build on the work that we did with our Task Force on Racial Inequities, and even before that, the partnership that we have with the United Way of Genesee County to start the Greater Flint Urgent Relief Fund that received more than $4 million in requests, and we were able to grant out more than $1 million in funds. We understood there to continue to be some gaps and for us to continue to search for resources that can help to fill those gaps. Today, we get to share or at least roll out a rapid response initiative that will hope to address some of those issues over the next 90 days. $2.5 million in total through the Michigan Public Health Institute in partnership with the Department of Health and Human Services and the CARES Act. We are able to get some resources out to support our community at this time. The rapid turnaround RFP process will include some Greater Flint Urgent Relief Fund unfunded proposals and some new community proposals. We will be seeking grantees or selecting grantees from those of you on the call and those that we've already vetted and had conversations with in 3 different areas. One of those areas is really focused on $1 million of unfunded applications through the Greater Flint Urgent Relief Fund process. $925,000 will be focused on the Task Force on Racial Inequities, leveraging shovel-ready projects that are happening in community that we can build on over the next 90 days. And about $250,000 will be supporting those Black-owned businesses on the ground doing the work in partnership with the Chamber of Commerce and maybe several other economic engines in our county. And so we are excited about the opportunity to do this work. And I am excited to announce Director of Special Projects at the Community Foundation of Greater Flint, Moses Bingham, to kind of lead us through this conversation. So Moses, you have the floor.
Thank you, Isaiah, for that alley-oop. I appreciate it. As Isaiah said, I'm happy to serve as the Director of Special Projects and Initiatives. And, as everything that is going on right now, what we're in, during this pandemic period, the Community Foundation want to do our due diligence into providing leadership and resources to a community that very much needs it. And please excuse while we're in this pandemic, you may hear my daughter, my 4-year-old, playing some Michael Jackson, but don't be alarmed. We have some great staff along with us today. The Vice President of Community Impact, Sue Peters. You can see, this is what she looks like right now, this moment, at her house. So we got that picture up for her, and she's going to be on this call to help with our Q&A during this process and help us talk through some of the things. Also, along with us on this call is Stephanie Whitledge. She is our grants administrator, and you can see Stephanie right there with her number and her contact. She can also filter any questions to myself, to Sue, to any of the team as we have this conversation and this Q&A today and anything online, but reminding that there is a very, very short turnaround time. And as we move forward, I just want to mention that we have other staff on hand as well, and we're just looking forward to provide this information and ensure that everyone can take advantage of this as possible. So as I mentioned before, there's a quick turnaround time of 7 days. We rolled this out on Friday during a webinar call, Zoom call with Ms. Yvonne Lewis. And so it's going out to Genesee County nonprofit organizations, and that are focused on, you know, the disparities during this pandemic period, looking to cater to African American and Latinx residents. So shovel-ready projects is what we're looking for, as Isaiah mentioned, the $925,000 in sub-grantee awards that we're looking to do. And so we have 6 categories that we should govern ourselves moving forward. But just a few housekeeping pieces. Request for proposals. Of course, it was issued on this past Friday. Applications are due on Friday, October 9th at 5 p.m. If you miss that deadline, you will get a notice saying, sorry, we are unable to fill your request at this time because it is 5:01. So early submissions are accepted and encouraged. And once again, late applications will not be accepted. Some things to remember and be cognizant of in terms of this rapid response initiative. The grants requirements in terms of this piece is that our decision will be made by the 15th. So you should be hearing the announcement at that time. The implementation is from October 1 through December 30th. So the funding are allowable expenses through that window, October 1 through December 30th. There's a final grant report that will summarize your project successes and lessons learned that are due on the 5th. But prior to that, the 5th of January of 2021. And then prior to that, we need financial reporting that is due and back on the 31st to us. With federal funding, there's a roll-up for a roll-up for a roll-up. And so we need to work in these type parameters. So keep that in mind as you're looking to shove out your projects and your different budget line items. So who can apply? Organizations within Genesee County are invited to apply to this, and you can see the listing here. But one thing to preface is that all organizations, whether you partner with a fiduciary, everyone has to have their 501c3 because this is federal money that we're dealing with here. So how to apply, once again, it's on our website. Some of you all may have received this email blast or via social media. And once again, the deadline is October 9th at 5 p.m. And once again, Stephanie Whitledge is available to answer questions. I'm available to answer questions, and the CFGF team is available to make sure and ensure you have what you need to make sure that the proposals are a fit. And once again, we're about to go through these six categories to make sure that your project is in line with the Federal CARES Act or these rapid response dollars. So once again, program requirements. You may be a new program or have an existing program or opportunity that you may want to be in line with this, and that's fine. So we need to just make sure that either your new program fits or your existing program fits as well in terms of an enhancement that you want to see forth. So for example, we're tying this into the $1 million that is available through the Urgent Relief Fund. Dollars. There were a lot of proposals that were unfunded and some things that were funded that could use additional dollars. We want to see those and be able to filter those out and get those awarded. So once again, the 6 categories. The first being medical expenses are apropos in here. the unmet needs for community testing, expansion of laboratory capacity to analyze tests, and innovation in testing to support school reopening and community reengagement. Public health expenses are apropos here in terms of PPE, sanitation supplies, or anything that gets an organization or an entity up and running safely. And that's also including places of worship. The payroll expenses, it outlines here what is apropos. And I want to highlight this second bullet more importantly. It must be support for supplemental payroll expenses to sustain vital staff needed during the pandemic and beyond. But mind you, we have a 90-day spend down, and every dollar has to be spent by December or no later than December 30th in order for us to ensure that we receive reimbursement from everyone that is involved that has a. And so we're thankful for the leadership in terms of the community foundation being able to take this on in terms of capacity because we're not holding up dollars to get this out from anyone. We want to make sure people get money in hand and that dollars go forth into the community. And so we're appreciative that everything that the Community Foundation is able to do, not holding up those dollars, but having a capacity to get those out. Once again, number 4, so actions to facilitate compliance with COVID-19 related public health measures. So support for expansion or restoration of staff, as well as capital improvements to essential public institutions and spaces to prevent the spread of coronavirus and facilitate ongoing engagement and needed health and social services during the pandemic. So who knows how long this is going to go and how much this has disrupted different organizations and entities, but we want to make sure that this is a piece that is adhered to if you feel that you are fit under this category. The economic support here is important. Expenses associated with the provision of economic support in connection with the COVID-19 public health emergency. So as we mentioned, for example, the Chamber is an organization that had a lot of proposals that were unfunded in terms of small business support. So they're going to be our lifeline in connecting those dollars to some of the community to ensure those individuals and those, not individuals, but those businesses receive some resources as well. Lastly, for number 6, our last category. So there's other COVID-19 related expenses that are reasonably necessary to the function of government. That's the last piece here. And we have a link here where you can go to the treasury.gov website, and you can see kind of some more things kind of drilled in and more specifically in terms of the guidelines and guidance for this piece. So if we can maybe put that into copy and cut and paste that into the chat and make that available so people can use that as well, that'll be great. And then once again, Stephanie and the Community Foundation team is ready to assist you with questions moving forward. But today is an opportunity to get those things in the chat so we can talk through some of those things. And then, like I said, we're eager to see the review committee getting these in hand and making sure that we make some great selections for our community.
Okay, great. All right, well, I'm not on by video. I don't even know if you can see me, but I'm Deborah for Holden. I'm one of the task force members on the Greater Flint Coronavirus Task Force on Racial Inequities. I'm going to be supporting the review process. I work with Isaiah Oliver and a few other leaders in Michigan to help get this money out into community. Here just really to answer questions, and I can see Community Foundation folks, we've got a bunch of questions popping up in the Q&A, so maybe we should turn it over now and pick up some of those questions. The first one is, can you have a fiscal sponsor or have a pending 501c3 status?
I'm gonna pass that to Sue Peters. She is our Vice President of Community Impact. Sue, would you mind jumping in on that question and sharing with us?
No, can you hear me? Just making sure. Okay, great. In this case, because they're federal dollars, we have to have a 501c3. So if yours is pending, I would recommend finding the fiscal sponsor. You know, with federal dollars, they're a little bit more strict. So I would, in that case, again, if it's pending, you know, great, keep moving in that direction. But for applying for these funds, I would recommend finding someone who already has their 501c3 in place, who's willing to work with you and partner around that fiscal piece.
Okay, great. We got a couple more questions. Can you clarify, this is 100% federal funding, question mark?
Simple answer, yes. A deeper answer is that this is through the CARES Act. And so much of the information is available on home.treasury.gov, where you can walk through the coronavirus relief funding guidance for state and territorial local communities. And so this is 100% federal funding through the CARES Act that is passed down to us through the state of Michigan, the Department of Health and Human Services, and the Michigan Public Health Institute.
Okay, great. Somebody has a question. I have an idea for mental health screening in collaboration with faith-based and U of M Flint School of Nursing. I would need a collaborative ASAP. So I guess, does that fit? A collaboration for mental health screening in collaboration with a faith-based organization like a church and a university partner such as the U of M Flint School of Nursing.
You know, the funny thing is, I think that would be an amazing project. I don't want to highlight concerns because I would suggest you call Moses, who actually shared his information earlier, and kind of talk through the project. The only concern that I would lift is that of it being shovel ready. Is if you're looking for collaborative partners right now, and we have 90-day, which is a little less than 90-day spin down, that might become a barrier for you in the application process. But I would say clearly you should apply and work with our team in order to get the best proposal in front of the review committee.
Okay, great. We have a question here from one of my favorites, Dr. Sarah Bailey. Will you allow one 501c3 to sponsor more than one grant? We have had requests to act as a fiduciary and or a physical sponsor, but plan to submit ourselves.
Dr. Bailey, you know we love you. And I'm going to answer this question and say absolutely yes. And I want you to know that it's not just because we love you. We will actually do this for others. You will have to demonstrate your capacity to support those organizations in that way as both a fiduciary and doing work on your own. And that will come out through the due diligence process. But that is absolutely acceptable. Unless somebody on my team like Sue says, hey, Isaiah, we can't do it. I think that we're fine here.
No, we would allow that. Definitely. I would just make it maybe clear in your proposal, and it should be, right? Which one is yours and where you're playing the role of fiduciary. But yes, that's just fine.
Okay, now they're getting harder.
Oh.
Emily Leonard asks, is there a recommended range for the grant?
That's a piece that, you know, we wrestled with putting this RFP out and not knowing, you know, what the exact need is and not knowing all the projects. We know that there's a lot of good work that's being done in the community. And so my suggestion is shoot your best shot, but don't price yourself out the game because you got to think there's a pot of $925,000 that we're trying to get out quickly into the community. So I mean, basically, I mean, if I were to give some guidance, I mean, a low end would be, $5,000. And then in addition, in that same vein, $10,000 would definitely be, apropos. But then you may have some, people whose capacity are different and have some awesome projects. But think of this in this way: if you shoot your best shot, can you be nimble enough to adjust? If the committee come back and say, "Hey, we have a $100,000 project. Can you do something for 50?" So think about it in those terms as well. How nimble can you be to adjust and pivot with a lesser amount? And then, and depending on the number of proposals, can you do something with more?
Yeah, this is Stephanie Whitledge, and I would just like to add, ask for what you need, but just keep in mind that we only have through December to spend. So whatever you ask for, make sure that you can spend it in that time frame.
Okay, great. Do you recommend new 501c3s connecting with another entity that has been in place as a fiduciary? So if you're a new 501c3, is that sufficient? Or do you need a longer standing 501c3 as a fiduciary?
This is Sue. I'll jump in. Just a reminder, Isaiah already mentioned, this is shovel-ready projects where you can demonstrate that you're able to spend down the money in 3 months. So I think that's one thing to keep in consideration, is to be able to demonstrate that as a new organization. And then the second piece is just, as a new organization, you might not be able to show, right, that you've had public dollars before. So just to think about those two things, because we want to be able to show that it'll be spent down in 3 months. That's really a priority, right? And spent down according to the public regulations. So in this case, you might, if you think you can do it, and prove to us that you have by showing, other programs or projects that you have done, we can look at it, right? Because you have your 501c3. If you think it makes a stronger case to work with a fiduciary to prove those 2 points, then you might want to go that route.
Great. Can you use money for capital projects, such as providing more housing for low-income people?
So that is, capital projects are an available expenditure. And Glenn, this, it's so hard to get capital dollars that when you do have a bucket of resources that allow for that, you try in this community to leverage it for it. It makes sense. The only barriers to making this happen is really, one, we don't get to go back to March 1st. We only get to go back to October 1st for these projects, and you have to demonstrate impact in the 90-day period. And so if it's a capital project that will be complete within the next 2 weeks, that way you can demonstrate impact over the balance of what will be like 7 or 8 weeks. I think that would make sense. But it's kind of hard when it's a competitive grant-making process, and many of the other proposals will be demonstrating impact over the 90 days. And this impact is about demonstrated impact over the 90 days, even if it continues after the December 30th kind of expenditure deadline. And so again, it's a competitive process, a competitive grant-making process. And so I would submit and have that proposal be in competition with other local proposals.
Okay. Are organizations that applied for or received prior project specific COVID-19 relief allowed to apply for this as well, for different purposes?
I had to unmute myself. I started yelling. Sorry. You are allowed to apply. You are allowed to apply, but this cannot supplant existing. So it has to be, and you said this, but I just want to make sure that people that are listening to this answer hear it as well. It has to be a different purpose, because if you've already received dollars to provide a certain service, that service is already aligned to other CRF related dollars. And Deborah, did I get that one? Did I get that one close to right?
Yes, you got it.
Yep, and I will add, this is Charlene, right, from the Ennis Center. So if yours is, Charlene, going to be a new project, then you'll want to look at applying for sure. We'll be reaching out to you through our GFRF response, because you're an existing grantee on that as well. But if it's a new project, then it would go to Moses and kind of through the task force route.
Oh, and you know what's interesting about this? And so I just mixed up,
Yeah, thank you.
I mixed up two different answers. So Sue's answer is 100% true, and mine is true. And I was reading your COVID-19 relief question to talk about, thinking about specifically about CRF funding through the federal government, which is
Oh, yeah, and I was thinking community
yeah.
funding.
And
So,
if you
yeah,
got dollars through the
yeah.
community foundation, which is a philanthropic resource, then you could actually have both.
Yeah.
That's clear.
And Charlene, you know to just email us, so.
Okay, we have a request here. I would need Mr. Moses's information again. Moses, can you just give your information again?
Yep, I caught myself typing that back into the chat and answering it, but it's simply M Bingham, BINGHAM at cfgf.org. That's the best way to contact me right now with your questions.
Okay, I'm going to read this one and then I'm going to hand it over to somebody else to read these questions. Emily Leonard. So Moses said the Boys and Girls Club can apply for a $500,000 grant.
Wow. Yeah, by all means, but listen to the caveat there. I mean, you're going to shoot your best shot. If you have a great proposal, and remember what city you in, what county you in, we have a lot of great people doing a lot of work, and we have $925,000 to divvy out to some great projects. So if you think that you're going to have this great proposal that will supersede everyone else that's competing for this, by all means, shoot it. But if it's that great, I'm just knowing this community and the response that's going to come out from this this opportunity. We're going to have a lot of people who will probably be coming with you and saying, "Hey, can you do what you want to do with a lesser amount?"
My recommendation to Moses's point would be that if you did shoot that particular shot, that you were able to demonstrate scalability down and up.
All right, okay, I'll just keep reading. Relative to hospital eligibility, we all received our own CARES Act funding based on our volumes of COVID patients treated, as well as the economic impact of lost non-COVID patient volume/revenue. Are hospitals still eligible for this funding? And that comes from Sue Tippett.
Yeah, hey Sue. The answer that I tried to answer for Charlene is probably apropos here. It makes sense that you would apply, but it would need to be a different project than something you were already funded to do.
Great, and that just goes back to your point that these dollars should not supplant other federal dollars and likely shouldn't supplant any other existing dollars, right?
Yes.
Yep, okay, great. Reverend Dr. Sarah Bailey asks, will you be able to spend federal dollars on food?
Yes. That is one of the areas, and I don't know which one it was of the 6 that Moses kind of walked through earlier, but access to urgent need foods is, I'm trying to figure it out, find it here, but Moses, you probably know better than I do, but simple answer is yes, Dr. Bailey.
Okay, great. Glenn Wilson comes back, doubling back to the question about capital improvements. And he says, we can have it done in 2 months and rent it in 3.
I would say that one, I appreciate you kind of doubling back, Glenn. And then this is the part where I think we want to move offline and have some of these conversations with Moses directly as we try to present your best proposal to the committee that's going to review it.
Okay, great. Luke Zelli asks, can funds be used to purchase 1, unfunded essential medical equipment like temporary home ramps to keep high-risk minorities in their homes instead of going to dangerous nursing homes? We have a waiting list. Or 2, training on implicit bias/cultural competency to decrease racial disparities in COVID healthcare services. If yes, what categories would they fit?
So I'm just going to jump in really quickly and say this is why I love our Flint nonprofits, right?
Yes.
Pushing the envelope and really truly thinking about the needs of our residents. So it may not, in my mind, but then I'm going to have Isaiah back me up or correct me if I'm wrong. But my thought is it could fit in either public health expenses. It's a thought, making sure that folks are safe. And then there's this other category, you know, at number 6. But Isaiah, what's your read on that? To me,
My read is, I'm trying to split these up in my mind.
Yeah,
So
yeah.
the first one around temporary home ramps kind of makes me feel like number 4 is appropriate. And I think this is the same
Okay.
that Glenn was leaning into around expenses or actions to facilitate compliance with COVID-19 related public health measures, right? And so what are you building to
Okay.
people have access in their homes or in public spaces that they wouldn't typically have access to? And I think this is both Luke and Glenn fit in number 4, and then it's about how we demonstrate impact over a 3-month period. The second one around training or implicit bias is very interesting, and I love the idea of it, and we have to figure out how it fit. And I haven't a pin on that one, Luke. It's nice seeing you, Luke, by the way, or seeing your name.
Okay, great. And let's not forget our catch-all category, number 6.
Mm-hmm.
Okay, Keith Bigelow asks, as a worship facility that is preparing to reopen, can these funds be used to retro fixtures to be contactless as well as other PPE?
I'm going to do the same as I did last time. Isaiah, back me up. I'm going back to the category number 2, but it talks about public health expenses, PPE, and then in there it says, and support for physical space needs to safely resume in-person worship services. So that would be my read, that it would be. And in all of these, my fallback is submit, but submit it, right? So that we can take a look at it. But Isaiah, what else are you thinking on that?
One, I think you're right on that particular read. And I think the follow-up there is the 501(c) or 501 status of that worship center. I think that's something that we have to completely explore or figure out what the partnership is with a fiduciary partner.
But if they have their 501(c)(3), they could. Okay, perfect.
Yes.
Okay, great. Glenn has another question. What about infrastructure for free internet to low-income tenants?
Yes.
Well,
Yes.
all right.
Budget for expenditure.
That was an easy response.
It was. That one was easy.
All right. That's all I can see in the Q&A for.
I got 2 more. There are 2 more. And if you want me to grab them, I can.
Go for it, Sue. Go for it.
All right. Would an organization be serving more of a fiduciary or fiscal agent responsibility? Not sure. Oh, okay. Well, I always see it as if you're willing to serve that role for an organization, it really falls on the organization that's receiving the grant to make sure that whoever's, your subrecipient is following through. And because it could come back, you're the one who received the grant dollars. So you just want to make sure that you have a strong partnership, you understand their strength, and you know that they will be able to meet the reporting requirements and the financial tracking and expenditures that you will need. So I think, to me, if you're willing to fill in that role, you just want to make sure you know who you're working with and know that you have a responsibility to get the information from them. So you want to know that they can do that. Hope that helps. Let's see, I had one. Oh wait, I lost it. Okay, here's another one. Could you please share the PowerPoint for this meeting and make sure that I am included in the email? And this is Hasselbrain, Beverly Lewis.
Hey, Beverly.
I know, I think we have you in our G for.
I kind of wish we were like in like the mode where we can see all of the pictures or something.
Right.
I want to wave at people.
Mothers of Joy University, hello. Haven't seen you in a while either. Thank you for all that you are doing to help us grow and develop. Well, you are welcome, and you keep doing up your work too. You're doing great. Athena, how are you? Could the final report, summarization report, be shared to ensure our goals and outcomes are measured throughout the funded time period section of the application?
Yeah, that's going to be fun because it's not just going to be the final report. It's really going to be that monthly reporting that's important. This will show up a little different than your typical if you are a CFGF grantee. It's going to show up a little different because we have to roll up reports monthly to the state in order to make sure they understand the track that we're on with all of these funded proposals. And so it'll show up a little different, but we will share that information for you.
All right. Dr. Wells Strozier, can your project be aligned to more than one initiative, 1 through 6?
Yes. Hey, Marseille. Nice seeing your name. I'm loving seeing these names. I wish I could see people's faces.
And I owe you an email, by the way, or I'm going to be reaching out to you too. So, but yes, okay. And then Dr. Bailey says, thank you for the answers, but then also has a question. Hey, that's a trick. No, I'm kidding. You should have kept these questions. What is the date we need a final report? Moses, I know you have that memorized. The final reports and the reporting?
Yes, for sure. So there's a financial obligation that has a quick turnaround of December 31st. So you are supposed to be spent by December 30th. And, the next day, you should be emailing us a final report, a final financial report of dollars spent. But then on January 5th, your successes, your wins, the final programmatic report is due January 5th of 2021.
All right. Okay. I have another question. Do nonprofit programs qualify to use funds to carry out virtual programming that responds to distance education around fresh food preparation? Isaiah, you want to grab that one? I think my answer is yes, and that it kind of catches a couple of them.
Yeah, it sounds like a master mix of a couple different pieces. I'm not sure who. Okay, that's Nina Lewis.
Yeah.
I would want to talk through that a little bit more. Maybe if you could send me a little bit blurb via email, Nina, and we can answer more succinctly on that. Unless Isaiah, you have some thoughts.
I guess my first read on it is that it is an interesting proposal, and I think it's the type of proposal that we want to see to kind of mix up the group. Proposals that you can see. The opportunity to provide, ultimately we're trying to adhere to some guidelines around staying home if you can. And if people need to understand how to prepare fresh food, that way their bodies, I like it. I'm kind of overthinking it right now and maybe drafting some of the proposal in my head. I don't want to go that far, but I like the idea. I don't know if it's Nina or Nina Lewis.
Yeah, and I think if you share it with Moses, we can also take it in-house and work with Damon to think through, Damon who works on our access to healthy food, and talk it through with you to see if it's a fit, but what you're working on. I think for me, the thing to keep reminding is, can it be spent down in those 3 months, right? That turnaround's tight. And is this the best funding source for what you want to do? Because it'll be a bit of a push.
Yes, Sue, I like it a lot. And I'll tell you, this is, I don't want to open this can up, but this is one where I'm thinking, one, we have over 500 funds at the Community Foundation. This is one fund that's going to be rapid response, but this idea of expenses related to facilitating compliance with COVID-19 related public health measures. And we're talking about doing food delivery as one way to do it. Distance education around food preparation might just be completely appropriate. I like the idea and the creativity around it.
Yeah. And then I wonder if I could, okay, that's it for the question. See, you should not have handed this over, Deborah. Look out. The question I had was going back to Athena's question about the final report and summarization of reports about kind of what we are able to accomplish. I wonder, Deborah, if you didn't want to talk a little bit, there's a portion of this that's for MSU to help us think through, right, the impacts of this funding and this work as well.
Sure. So for every funded project, we'll have some basic, very simple measures with very easy reporting that all grantees will have to comply with. And then we'll also have just a little bit of a look and a little bit of customization, depending on what the project is, who you're serving, et cetera. And we want to be fully transparent, and we want to measure impact. We also have now gotten today a formal data user agreement in place with the Genesee County Health Department. So we'll also be able to look overall, going back in time, what was the overall impact of the Urgent Relief Fund that happened many months ago? And was there an overall impact of these resources and other initiatives that are happening in Flint overall in reducing both disparities in COVID-19? Remember, this is coming through our Greater Flint Task Force on Racial Inequities and COVID. And then also, was there some overall improvement in the city overall? So the short answer is yes, that final report will be vetted through the task force and will absolutely be available for public view and consumption.
Oh my
Great.
God, that's great. And I tell you what, I think what Deborah and Moses are experiencing is Sue and I are really missing authentic community engagement, conversation, and dialogue. And so we're jumping all over this call.
Yeah, I apologize. I just knew there's so much good stuff tied into this. I didn't want you all to miss it.
Yeah. All right, I think you got some more questions popping up.
Oh, wait, will you grab them? Can you grab them? I lost track of them.
No, this is
Okay,
Nina
got it.
Lewis kind of responding
okay.
again, giving us more detail. I appreciate
Oh,
and she also said she was going to send the email to Moses. And so I think we should look forward to Moses having that conversation. Glenn, I have questions if you want more, man, stop.
we know that, Glenn. You didn't have to put that in the chat.
Exactly. All right, this has been time well spent. I've enjoyed. We might be able to leave some time on the clock. We have 15 minutes left for this, but honestly, we're ready to get to work and ready to start working alongside these nonprofit partners that are doing the work on the ground. So thank you all for all that you do.
Folks are asking for the presentation. If you're okay with it, we sent it to Becky Salter. Isaiah, is it possible that you guys can put that up on the Community Foundation's website? Also, a recording of this webinar. We will shoot you a link to it in about an hour. And I encourage people here to just go to the Community Foundation Greater Flint website and they can share the link to the recording of this webinar with others who weren't able to make it today, because I think they asked really great questions that others might have also.
Yes, thank you, Mary Laura, for asking that question. Mary Laura's probably looking like right now, like Moses and Isaiah in the same place again.
Uh-oh.
Exactly.
The gig is up.
All right, Isaiah, you're the CEO. I think it's up to you to dismiss us and gift us back.
Well, I gave my thank you, and again, we are looking forward to working with our community in this way. This is what we're here for. And so thank you for giving us the opportunity to partner with you. And we are looking forward to doing this great work for Flint and Genesee County. You all have an amazing day.